Good morning, I am Dr. Kelly Entz. I'm an otolaryngologist, an ear, nose, and throat doctor, and today I wanted to spend a few minutes talking about tonsil problems. And I could divide these into infectious or obstructive, the two major situations that we see. Recurrent tonsillitis is a fairly common thing among children, also extends into teenage years and adulthood. Someone might ask, what is tonsillitis? In the throat we have tissue in the back of the throat that consists of tonsils. The same tissue extends into the back of the nose called adenoids. And these tissues will get infected or inflamed with a sore throat. Sometimes it starts as a viral infection, but very commonly is involved with what everyone is aware of called strep throat or a strep infection. But not all tonsillitis is strep. It's important to realize that. We will see patients who have had recurrent bouts of strep throat, and often the family and the patient are frustrated that they've had so many, and they miss a lot of school. It interferes with a lot of activities. So there is an option. Again, the criteria of our National Academy, and based on a lot of good studies, is that if the patient has had 7 episodes of tonsillitis in 1 year, 5 episodes of tonsillitis per year for 2 years in a row, or 3 episodes of tonsillitis per year for 3 years in a row, then they fit criteria for which we feel they will benefit from having their tonsils and adenoids removed. There are several other indications for a tonsillectomy. One of them is, as I previously alluded to, tonsils can be very large as well as adenoids, and particularly children under 10 can have obstructive symptoms from large tonsils and adenoids. That can lead to snoring, gasping, difficulty swallowing, and even sleep apnea. So those are situations for which removing the tonsils and adenoids provide a dramatic improvement. And that is probably the second or maybe even the most common indication for removing tonsils and adenoids that we see. People will ask what a tonsillectomy is, and again, it is a very common operation, one of the 2 most common operations done in a pediatric population. Tonsillectomy is done as a same-day surgery in almost all cases now. The patient is put completely asleep with general anesthesia. They have an IV started many times after they're asleep, and they're intubated so that we can work in the mouth and be able to remove the tonsils and adenoids. And there are several techniques or methods of removing tonsils and adenoids, all of which combine for an operation that takes anywhere from 15 to 25 minutes. Most people that know about a tonsillectomy are aware that it's a fairly painful recovery, and that's the biggest downside. We're able to provide analgesics and measures to try and deal with that, but it is an uncomfortable operation to recover from. All in all, though, we feel like it is beneficial enough to be worth going through that. Yeah, there are risks to any surgery. The most notable one, which is a small percentage in tonsillectomy, is postoperative bleeding. That risk is as high as 1 to 4% depending upon the studies you see. Usually most of them average around 2%. We'll have some bleeding most of the time approximately a week after surgery. And this is often self-limited, but sometimes requires intervention by the surgeon. And that would be cauterizing the bleeding vessel, or possibly returning to the operating room to cauterize or put a suture in to control the bleeding. A second complication or risk is dehydration. And that's why I always emphasize to the families and the patients the importance of hydration, keeping the child drinking, staying ahead of that, so that they do a lot better if they don't get dehydrated. So it's a matter of some encouragement. Pain management is also a challenge in some cases, and so occasionally that will have to be dealt with, but most patients do fairly well. One of the things that I find helpful is starting encouraging the hydration from the very beginning before the pain seems to get worse on the second or third day. That helps a lot. There are other little tricks like chewing gum, finding what they will drink, eating popsicles, various things that can assist in keeping them hydrated. The diet after tonsillectomy is mainly restricted to avoiding hard, crispy things. If they chew up their food well, they can eat fairly substantial soft food, but I encourage them to stay away from hard, crispy things like taco chips and whatnot. A lot of them don't have much of an appetite, so it's not usually much of an issue in limiting their diet. It's mostly encouraging hydration and fluids that we emphasize for the first 10 days or so. I always encourage that they don't do anything exertional for 2 weeks. No sports, no heavy playing for 2 weeks, feeling like there is a slight risk of bleeding if they overdo it in that time period. Most of them are kind of able to self-limit themselves. When they start feeling better, then they start increasing their activity. But it commonly is about a 2-week recovery, sometimes quicker. So we've discussed issues with tonsils that we frequently see, and mainly recurrent infection and the issue of tonsils and adenoids being large or hypertrophied. Those can both be addressed with a great benefit by surgery if they fit the criteria. If you have some specific questions, feel free to contact the hospital or my practice, or the American Academy of Otolaryngology Head and Neck Surgery website has good information for the patient and the family to review.